Given the mysterious downward trend in U.S. fertility rates, surrogacy is quickly becoming a popular option for couples looking for an alternative. This method allows people to have a child that's genetically theirs. The caveat, another woman carries and delivers the baby in a process called gestational surrogacy. Today, this practice has been commercialized, meaning the surrogates are paid a salary in addition to the intended parents covering all medical costs. And as many countries have begun to outlaw commercial gestational surrogacy, states in America are just starting to legalize it.
Surrogacy is generally dangerous because all pregnancies have a tendency to be dangerous just as a matter of health and fact. But the commercial surrogacy element of it really brings in third-party exploitation for the profit of a few and can lead to horrific abuses, including trafficking.
That's Taina Biename, Executive Director of the Coalition Against Trafficking in Women. She's been an outspoken critic of the Child Parent Security Act New York State passed in 2020 that legalizes commercial gestational surrogacy. Biename says the law doesn't adequately protect the surrogate mothers, and since some women who become surrogates are in desperate need of an income, Biename doesn't believe their choice is given, free, and willing. A 2017 study published in Fertility and Sterility reviewed 104 gestational surrogates to get a sense of the average demographic. It found that nearly half of the women were unemployed.
It's almost like there's an absence of choice when you have to pay the rent or the mortgage, or you have to fend for your children, and therefore you're going to sell parts of your body for what? The average payment of a surrogate mother for a surrogate mother is anywhere between $16,000 to $30,000. So you see the economic inequality, the abuse of power, the abuse of vulnerability that really makes commercial surrogacy possible and profitable.
Dr. Linda Kahn says the potential for exploitation isn't the only concern. Gestational surrogacy increases certain health risks for the women carrying the pregnancy. Kahn is an assistant professor at NYU Grossman School of Medicine. All of her opinions are her own and do not reflect those of her institution. She says while a regular pregnancy always comes with risks, those threats increase with surrogate pregnancies for both the carrier and the baby.
Commercial gestational surrogates are very often impregnated with more than one embryo because it's financially advantageous for the families who are contracting with them to get their money's worth. And this is not recommended in normal IVF, and yet it is tolerated in the case of commercial gestational surrogacy, which is frankly unethical because the American College of Obstetrics and Gynecology says black and white, you should not be transferring more than one embryo in a pregnancy with a healthy, fertile woman carrying the pregnancy.
One reason is because there's a high risk of the embryos splitting into twins. Kahn says twin pregnancies have higher incidence of premature birth and lower birth weight. Both conditions can have a harmful impact on the child's future. And though many surrogates are assessed for their physical health, Kahn says commercial gestational surrogates have a much higher risk of pregnancy complications than they should.
These are women who've been vetted for this job, and one of the criteria is that they have in the past had healthy, uncomplicated pregnancies. They're at very low risk for pregnancy complications, and yet we see a higher rate of pregnancy complications among this population than we do of other women of their age and fertility. So we know there's something about this process of commercial gestational surrogacy that is putting the women at high risk.
Some of it could be attributed to the twinning, but Kahn says another factor is that the embryos have no genetic relationship to the surrogate.
If you normally conceive or naturally conceive a pregnancy in a heterosexual relationship with a partner that you've been having a relationship for a while, your body will tolerate that pregnancy. It's not going to attack the fetus because it recognizes some of it as self. However, these women don't have any signal coming from that fetus that this is self. So it's likely that their bodies are having some kind of an immune response to that pregnancy.
The immune response may not be strong enough to kill the fetus, but Kahn says it could increase the amount of inflammation in the body, a response that's known to trigger preeclampsia.
Preeclampsia is when you have an inflammatory condition in your placenta, which is the organ that's communicating between you and the fetus that you're carrying. So biologically, it's plausible that this heightened risk of pregnancy complications that we see among women who act as commercial gestational surrogates who are otherwise completely healthy women may be due to the fact that you're putting a completely foreign body inside of them.
But we can't know for sure because there's little research on gestational surrogacy or even egg donation. Kahn says the best data scientists have has been painstakingly collected by researcher Diane Tober. Tober's found substantial evidence of women having adverse health outcomes after selling their eggs.
There's a lot of pressure to produce lots and lots of eggs when that may not be to the benefit of the person who's providing them health-wise. And also they have to take high levels of hormones as part of the process, because normally our bodies produce one egg, maybe two a month, not a lot. And these women are being stimulated to produce sometimes 40, 50, 60 eggs in a month.
The most data from egg donors is collected from the website weareeggdonors.com, where women voluntarily submit information about their experience. Many of these women report overstimulation of their ovaries, which Kahn says can harm their bodies when the eggs are extracted. So is there a way to make commercial gestational surrogacy a safer process? Ashley Mareko is a 3-time surrogate and works for Surrogate First, a commercial surrogacy company. Mareko believes companies should have accreditation programs to protect both the intended parents and the surrogates.
A surrogate can't be on welfare and food stamps and Medicaid. She should not be on any of those things. This should not be something to supplement or an income. It should not be considered a job. What it should be considered is more of, you're doing this to help a family, but you're benefiting with this compensation for the pain and suffering. And being able to then, use that for other plans.
Mareko's compensation made it possible for her daughter to receive extra help for her learning delays. She says Surrogate First makes sure potential surrogates are healthy by looking at previous pregnancies, medical histories, and more.
From the agency standpoint, we really accept only 6 to 10% of the applicants. By the time we get through medical records and mental health evaluations, drug panels, the 2 months we spend with them communicating and educating. And I think that's why, it's important to have those things in place.
But are all surrogates going through this same process? Do all women entering surrogacy understand the emotional toll of what the position entails? Kahn says that once a woman signs a contract under the New York law, she must give the baby to the intended parents, no matter what.
There have been the most horrendous stories. There have been stories of intending parents who've turned out to be child molesters. There have been stories of intending parents who've had horrendous criminal records. If a surrogate discovers anything like this, she still has no choice, according to this law, but to hand over that baby to those people by contract. She has no way of backing out of it. The only way she can back out of it is to terminate the pregnancy, because the only right she retains is to an abortion.
Bien-Aimé says this is a woman's rights issue. She argues that our efforts to create gender equality have failed to include surrogates.
We're creating a class of women who are absolutely disposable, commodified, put on the marketplace for a limited amount of income and probably a lifelong journey of adverse health consequences if she survives.
The Commonwealth Fund reports that the U.S. has the highest overall maternal mortality rate when compared to similar developed countries. Bien-Aimé says we don't know how many of those deaths are attributed to surrogate mothers.
The last 2 women who died as surrogate mothers, the only way we found out is because their husbands organized a crowd fundraising platform to pay for their funeral costs. So you see how economically strapped the family is. Everyone has a right to a family, but no one has the fundamental right to a biological family. So there is this desire, and this is not to take away from the enormous pain and suffering that infertile couples have to endure. We fully understand. But it's always when we talk about rights, we have to see whose rights we're violating.
Bien-Aimé says it's the role of the state to crack down on these violations and create rules to keep them from happening.
Do we live in a society where we're saying we are going to create a special class of women who are here to be put on a marketplace for the desires of the rich? And that's a fundamental philosophical question, I think, that certainly New York State and California doesn't care about.
A question that brings to light the legality of purchasing a body. Where's the line between selling organs and selling healthy eggs? What's the difference that makes it legal for women to rent out their reproductive systems, but not the rest of their bodies?
The state has prohibited us from selling our organs, and we cannot have child labor, or we can't be in debt bondage just to survive. But somehow when it comes to women, there's always an exception to those overall policies.
An exception that's grabbed international attention. After the Child Parent Security Act was passed, a UN expert on the sale and exploitation of children reached out to Bien-Aimé. The expert asked her to write a letter describing the law to be presented to the UN Human Rights Commission.
Her position as special rapporteur is that the children who are born of surrogate mothers are exploited and for sale, technically, right? So parents purchase the child. They not only purchase the reproductive organs and the eggs of two women, but they also purchase the child.
People don't even think about them in the sense that you're creating a person, and that person has rights. And that person has rights not just to not being put at risk from the time they're in utero by, say, for example, being part of a multiple gestation and having the risk of being low birth weight and preterm birth that will potentially lead them to have all kinds of complications for the rest of their life, but also in terms of their identity.
The passage of New York's law places them into a growing group of states that have legalized commercial gestational surrogacy. However, there are currently no federal surrogacy laws in place. You can find more information about Taina Bien-Aimé, Ashley Moreco, and Dr. Linda Kahn on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence.
Coming up next week on Radio Health Journal,
we need to think about how can we protect some corner of that metaverse for good, not for some dystopian Ready Player One future, but for health and wellness.
How healthcare is embracing virtual reality.
Then sunbathing this summer may be riskier than you think.
A tan is a sign that the DNA of your skin cells has already been damaged. So there's no such thing as a healthy tan.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
You have this wonderful opportunity to lose yourself in a creative analog task and to really focus on something and let the outside world just melt away.
Think coloring is just for kids? Think again. Then.
It's not uncommon to have kids on the beach find cigarette butts in the sand. And in fact, there's been some cases of kids consuming them, many cases actually, and having nicotine toxicity.
The many dangers of dumped cigarettes. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.